TMJ is really can be tough to explain. In reality, is TMJ means temporomandibular joint. We all have two of them. What makes the temporomandibular joint very unique is that the terminus of its closure is actually the bite. So unlike your knee joint that has a physiologic position that it will only go so far, the joint, the temporomandibular joint, actually its endpoint is the bite, is the teeth. And oftentimes, this really goes back from the Industrial Revolution on, is a lot of us are chronically allergic to our world, whether it be pesticides, whether it be pollutants in the air. And because of that, when we were children, we had inflamed tonsils and adenoids. Because the tonsils and adenoids are inflamed, the tongue has to posture differently. Well, unfortunately, the tongue plays a pretty important role in the dental arch development. So as the tongue, if it's sitting correctly, the arches grow out. But if it has to posture differently to allow us to get oxygen, body's pretty smart, brings the head forward, the tongue drops down on the floor of the mouth, and we're able to breathe. But if the tongue is not there to play that role, we end up with crowded teeth, very narrow dental arches, and the bite that's not in a good position. So you find people with very deep bites, very crowded teeth, and a lot of times those people become our TMJ patients later on. Many times, unfortunately, and I don't mean to say this in a way that's negative to orthodontics, because I had orthodontics, my children did, but a lot of times the orthodontist will exacerbate the problem. So they'll even bring the jaws back farther, they'll take out teeth to try to straighten them, and these people later in life will end up with TMJ problems. So I like to use the word TMD, or temporomandibular disorder, or even more exact is CMD, craniomandibular disorder. Because the reality is about 80% of the pain that these patients have don't come from the jaw joints, they actually come from the muscles of the face, the musculatures that bring the jaw together. So oftentimes TMJ, because you'll hear that word, and so we'll sometimes say TMJ patients, these TMJ patients will have headaches, muscle aches, neck aches, they could have numbness in the hands, forward head posture. They can have lots of different things that lead to a lifetime of chronic pain. Unfortunately, this is something that dentists learn very little, almost nothing about in dental school. So the majority of dentists, probably more than 9.5 out of 10, it's probably 9.9 out of 10, know absolutely nothing about how to treat TMJ, or so little that they don't even want to treat it. They know enough to know that they don't want to treat TMJ patients. Well, my training through the Las Vegas Institute and my years of studying neuromuscular dentistry is we're able to use some instrumentation. We start with a TENS unit, and the TENS unit allows us to relax the musculature of the face, begin to get the bite into a physiologic position. And then there's various things we can do by realigning the bite. Sometimes we do it with porcelain, sometimes we do it with bite guards, night guards that wear at night or all day long. And these various night guards or realignment of the teeth, sometimes the orthodontics, allow us to put the bite in a physiologic position that eliminates pain. One of the most rewarding things I'll ever do is somebody comes to me and patient will come to me with a list of all the different doctors and caregivers and chiropractors and pain specialists and acupuncturists, all these different people they've gone to try to get them out of pain. And unfortunately, the more you see medical professionals for pain, they all write you a script. They all give you pain medication or muscle relaxers, antidepressants, different things like that. What we're able to do with neuromuscular dentistry is to realign the bite, put the muscles in a happy position, and get them out of pain, get that patient out of pain without any medications. We want to get them off of the medications. So oftentimes, it's not that it's simple, but treating TMJ patients correctly can change people's lives.